Hello everyone, welcome to an episode of TooHealthTalk, a show where we get to discuss real health challenges and get to break it down in a very honest and simple conversation. On today's episode, we have a very special guest, another special guest, Dr. Tolu. Dr. Tolu is a public health expert and also a very high respected medical doctor here in Nigeria. And I'm very excited to have you here, Doctor.
Thank you very much. It's a pleasure to be here.
Yeah. It's not easy getting you on board even with your busy schedule. I'm so excited and grateful to have you here.
It's my pleasure.
Yeah. So on today's episode, we'll be talking about herpes. Herpes is a very serious transmitted disease that people don't get to talk about. Like people only know about HIV and AIDS and other ones, but they don't know about herpes. So can you give us a breakdown of what herpes is?
Okay, thank you. So, herpes is perhaps better called herpes simplex viral infection. You know, so of course we say herpes infection. Yeah, so it's caused by a virus, herpes simplex virus. You have herpes simplex virus 1 and herpes simplex virus 2. So permit me to just say HSV henceforth. So there's HSV-1, there's HSV-2. However, they have routes of infection that actually vary, typically around the mouth. So you can have a mouth to mouth transmission of it. Yeah, you can have a skin to skin transmission. And when the skin to skin also occurs around the genitals, then you can have, like a genital to genital transmission, which is like a sexual transmission of HSV. So basically, it's it's a viral infection, and those are the roots of infection. In terms of prevalence, if you're asking me that as well, so here in Nigeria, a study was conducted, I think, and published sometime early in 2025. That suggests somewhere in Lagos, that suggests that about 59% of the population,
Wow, 59?
yes,
That's a lot.
is infected
Almost half, more than half.
by HSV. So again, you know how studies are done. So perhaps this is around the Lagos axis and from what they found and what have you. So yes, that's it for now.
So you talked about HSV 1 and 2. So what's the difference?
So again, those are for virologists and the laboratory experts to sort of decipher. But from a public health point of view, is just to know that you have something called HSV, which is herpes simplex virus, and typically we have 1 and 2. So it's been reported that yes, maybe HSV-1 it causes more of the oral type of herpes infection. Of course, that doesn't mean that you can't also find it, isolated for genital or sexually transmitted, herpes. And then it's also been reported that you find HSV-2 more around the genital, strain of it. But again, you can find 1 and 2 in both ways, either the oral transmission or even the genital.
So what are the symptoms?
So so typical of most viral ailments. Um, so you get, they are communicable. They cause communicable diseases. Let me use that word. So if you come in contact with the virus now, either through kissing, typically for the oral herpes, or through sex or unprotected sex, which can be either genital penetrative sex or even oral sex.
Wow.
So what happens typically is, like most viral infections, the symptoms that may follow are non-specific, initially, before you eventually see the one that looks definitive, in terms of suspicion. So the non-specific symptoms can be, someone can just have fever, so the incubation period is somewhere between 2 days and 3 weeks. So anytime between this number of days I've talked about when the person came in contact with the virus, you can have fever, you can have headache, you can have general body weakness. Nothing very specific that may just even suggest, oh, this person has a febrile illness, but you're not sure. And can even have diarrhea, like every viral ailment. All right. So there's something we call prodromal stages of viral infections, where you have non-specific symptoms of this infection. So you can have that before there will now be that sore or the blister, which people look out for to suspect, herpes simplex virus. So that's like the, one of the signs you would eventually see. But just to say, it may not be one of the first signs. So what you may see, or symptoms rather, what you may see initially may just be non-specific symptoms of a viral infection. So which can be fever, headache, body pain, diarrhea, just any other thing, before the sore will not appear, either around the mouth or around the genitals.
So you talk about kissing. Most people think that for you to get a disease or a transmitted disease is when you have sexual intercourse. Now you're talking about kissing now, so we should mind who will kiss or stuff like
Oh
that.
yes, yes. So again, that's why, where I started, I tried not to say HSV is a sexually transmitted disease alone. The reason is because, I won't call kissing sex, you know. So the virus can actually also be spread through that kind of contact from, with
Wow.
saliva. All right. So, I mean, just like several other viruses can also be transmitted, or even, what's it called, pathogens,
Wow.
can be transmitted, through mouth to mouth contact and saliva. So HIV is one of them as well. And again, so if you observe, there's something Yorubans call, so when somebody has fever, I'm a Yoruba person. And so they say, you see sores sometimes around the person's mouth. They say, only Ishino. We call it Ishino. So Ishino, cold sores, is actually caused by HSV.
Wow.
So it's herpes simplex virus. So again, when did that person come in contact with someone that had the HSV? I don't know. So but what usually happens is you probably have the HSV virus in your body because of its typical characteristic that it can be latent. It can just be there and not cause anything. So the first time it will cause something, but subsequently it remains in your body but can be inactive for a long time. And then when something happens, like maybe you have an ailment or you are on a drug like a steroid that suppresses immunity, or you have certain other comorbidities like diabetes mellitus, HIV, etc., or even a what's it called, a malaria fever, something that can suppress your immunity for a while, then the virus that had been inactive suddenly becomes active. And so sometimes, we're not surprised when you now have someone who says, I have that issue when I have just malaria fever. So it's probably because the virus has been in your body, it's been inactive. But this acute presentation of a suspected malaria, what's it called, infestation, as it were, can now allow that virus to now resurface and then gives you the cold sores around your mouth. Yes.
Wow. So how can this herpes be cured?
So when you say cure, it's a very tricky term. So there are certain pathogens as causative organisms for diseases that we don't use the word cure for, because when you come in contact with them, they can actually remain in your body forever.
Wow.
The only thing is that they may not harm you. All right, they may not harm the
So
host.
now you're saying so many people are walking around now with herpes.
A lot of people are walking around with herpes.
Wow.
Just like a lot of guys are walking around with human papilloma virus, HPV, around their genitals. All right. And then it may not harm them. But then they cannot transmit that to a woman. And depending on the strain, HPV cannot go on and cause either a cervical cancer in that woman over time, all right, or even what we call genital warts, which are also caused by HPV. So I just use this example to tell you that there are a lot of these kinds of organisms that people carry, but you may not know. All right. So hepatitis B is another example. So it may show up at some point if someone has hepatitis B infection, but I won't want to go into some science about it. Some people just carry it around; it doesn't harm them. Other, it has the potential to destroy their liver. But if they pick it early and then a line of management is instituted, it will not destroy their liver anymore. However, they may never, not that they will never be able to, for instance, donate blood to anybody. Because at every point in time that you check, their blood, you will find the hepatitis B there, even though it's not harmful to them anymore. So HSV, which is what we're talking about today, is one of such. So yes, you get, you contract the virus, it maybe shows up initially with some of these acute, non-specific symptoms I talked about, and then eventually you may have a sore or some sores around either your mouth or your genitals, depending on where it is, and then you get cured. In fact, in many instances, you may not even need a medication for it. So your body may be able to fight it, and it may go. But for some others, they may need medication. But after that line of treatment or whatever, it becomes inactive, but it will always be present. in your
Wow.
body. That's something about HSV, but it will be inactive. And at any point in time you have any stress on your health, that drops your immunity, it may then show up.
Oh, so what's the best practice now to prevent this?
Fantastic. So honestly, first of all, it's always good to be aware. So I remember when I was doing sex education for my then 7-year-old son with his alongside his elder brother who was at that time 10 years old. I still did it for them recently. Now they are 13 and nearly 10. And I had to tell them, after talking about sex generally, to now tell them there are infections that you could contract. So I was telling them HIV, hepatitis B, hepatitis C, human papilloma virus, HPV, HSV, herpes simplex virus as well, that causes what we are talking about today. So the point is, people should be aware and then start to practice safer sex. All right. So safer sex where you get protection using condoms. You have male and female, with your partner. Because ideally, maybe what the world will get into now is you start dating someone, and then if for any reason you guys need to have sex, then you probably go to an infectious clinic or a laboratory and you run some of these to know your infectious profile, and then you can say these are the things we are checking for. So that once you know whether someone has, your partner has, or does not have, but that awareness of safe sex is very important. So with safe sex, you are likely to reduce, that your chances of getting not just the HSV but all other sexually transmitted infections. And of course, I just told you that there's oral transmission. So we should also be careful with kiss.
Well,
So yeah, that's it.
well, so now coming to this, what are the medications now that you can?
So you see, again, the challenge is when you come on shows like this and you're doing health promotion, let's always be careful. Google has also even made a lot of people assume that they are health workers. So there's a danger usually in sitting down in these kind of conversations and just talking medications, because you lose the whole essence of having a proper health system that allows people to interact with the health system, get to see your doctor or whoever you need to see, and then we'll go through a proper scientific, evidence-based, channel of making diagnosis and treating. So just to say, however, that there are medications that can be given, antivirals, but I won't be mentioning names,
Yeah.
not because I don't know the name, but so that we don't just get someone who is listening now and say, oh, that doctor came on the show and said, once I have this, who even told you that he saw you have is actually caused by HSV? Because I give you an instance that human papilloma virus, HPV, can also cause a genital wart. So even maybe what you're looking at now is not HSV, is actually a genital wart. And then I'll now tell you medication, and you now go and use that medication for the wart, and then you say you're not feeling good. So just to say, there are medications if they have to be instituted, but please, once you suspect anything that is awful around your genitals or some sores around your mouth, please go and see your doctor. And then they would examine, take a history, do a physical examination, even request necessary investigations. All right. So they can take your blood sample, and then they will check if they suspect it's a HSV. Or sometimes you can even take a swab of the sore, and then you also send it to the laboratory to go and do what you have to do. And then we'll come back and tell you this is what it is, and then this is the medication that you can use for it. Yes.
So is it more risky than HIV?
So again, you see, I don't like that comparison because it's a subjective term to say more risky, But okay, maybe I'll try to answer it. Because, for instance, hepatitis is actually a very virulent infection as well. B, for example, that when you say, is it more risky? The truth is that because we have only one liver and hepatitis, B or C virus, has a predilection to stay in that liver and destroy it, then if you look at it from that point of view, we say, oh, it's deadlier than HIV. But again, it doesn't mean that HIV does not also have its own deadly presentations, especially if the person is not aware that he or she has HIV, let alone commencing treatment early. So for HSV, the truth is that most often than not, it's acute presentations that people have. So, you come in contact with the virus, you manifest those non-specific symptoms I talked about, and then so fever, diarrhea, headache, whatever, and then eventually a sore appears. But again, if you're lucky, your body fights it. You may not really need a medication. The sore can go on its own. But sometimes you may need medication, an antiviral, and if you are given the antiviral over a period of time, it will also go. So the symptoms will go. But like I said, the virus remains in your body. However, it will not harm you. It will just be there. But the moment you have anything that suppresses your immunity, whether it's an acute infection or any other chronic infection, or a chronic infection, I beg your pardon, then it resurfaces and gives that manifestation again. And then after that, it goes silent again. So if you look at it from that point of view, I won't say it's deadly. All right. But the truth is that for those who have contracted this, it remains in their body. And that's just the truth.
So what I'm understanding now is that you can't treat herpes.
No, you can treat. Treatment is
You can only
different
see the
from cure.
symptoms. Okay. So,
Treatment is different from cure. Cure means that I institute a treatment, I go there, I don't find whatever the causative organism is anymore. That's cure. Do you understand? So treatment, HIV is treated, but it's not cured. So people can take their what's it called? The drugs for HIV, all right, antiretrovirals, and then you take it for life. And you live a normal life like every other person who does not have HIV. But it does not mean that if I go there, I will not see the virus. I will see it. But so long as some other parameters are good, your viral load, we want it to be at a very low level, and then your CD4 count, and stuff like that. So it doesn't mean the HIV will not be in your body. So it's not cured, but you can be treated, and then you lead a normal life. So I hope you understand.
wow. So anybody that has herpes,
HSV, yes, herpes, yes. That's the thing. So every time we go, they will find it there.
Wow, man.
Because it goes inactive and can even stay around your nerves.
Wow.
All right. So, but in some very extreme cases where people have had, a resurgence of the virus in their body, in very rare cases, some have actually had it destroy even their nerves.
Wow.
After some time. But in majority of people, after that acute initial presentation of you contracting the virus, and then it goes silent, you may have repeated recurrence, maybe sometimes 6 times a year. After some time, it just comes up again, the sore appears, you get treated, then it goes. It's because the virus is still in your body, but it can be there. It will be there for life, but it may not harm you until such occasions present themselves, when the acute presentation now resurfaces again. So I hope I didn't confuse anybody.
Yeah. So now you're a public health expert. Why do you think herpes is not talked about enough?
Yeah, so again, and there are many ways to answer this really. So one way is to say that the way we have conducted our health promotion exercises in Nigeria, especially for diseases of public health importance, is that we seem to have focused largely on disease programs that are funded by external donors. So that's why you had more awareness around HIV, around tuberculosis, for instance. But we are low as a country on several others. So I think it's because the system, the healthcare system in Nigeria, has allowed external donor funding for specific disease programs to overshadow several other diseases that are also of public health interest. So that's what I think it is. And then, because for me, again, what I always say is health promotion is probably the cheapest of the 5 forms of healthcare services that makes up what we call universal health coverage. All right. So because in universal health coverage, you talk about promotive services, preventive services, curative services, rehabilitative services, and palliative. So for the promotive, like I said, it's been more of those disease programs that the donors fund. But for every other, we have been low on it, and it's unfortunate. So I think that's the reason. So same thing for hepatitis B. So for hepatitis B, for hepatitis infection, rather, viral hepatitis. I beg your pardon, viral hepatitis, because hepatitis can also be caused by alcohol. All right. So, but the one that is infectious is viral. So hepatitis A, B, C, D, E. But B and C, are the ones we talk more about. So, and the awareness is quite low as well, probably because we've not also had public health disease programs that are funded by donors that focus a lot on them. So we hear more of HIV and tuberculosis. So that's the reason, really.
Oh wow! So what's the misconceptions about HSV?
Well, so there's a close differential. Somebody has the sore caused by herpes impact. Sometimes, if you're not a doctor or a nurse or someone who is experienced in that line, you may think it's a genital wart, and their modes of treatment are actually different from each other. So the misconception really for me is, first of all, there's probably maybe there are some cases of misdiagnosis by persons who are infected. All right, which is why I say anything you see, ideally, go to your GP, go to your hospital, let your doctor, and their team examine you and then tell you this is what it is. So that's the first part. The second part is probably around, no, maybe except for HIV, any other sexually transmitted ailment is not really a big deal. So maybe that will be another misconception for something like HSV. So because, like I said, there's so much health awareness about HIV. But so let people be aware that there are several other sexually transmitted infections. And herpes simplex virus, HSV, is one of such.
So herpes can kill.
So now let's be careful. I'm a doctor. You don't just say something can kill. See, you have, for instance, a comorbidity like you have diabetes mellitus, and then, okay, let me say you have HIV or any of them, and then you now get a herpes simplex viral infection, all right? So genital herpes, for instance. The point is, your immunity is already suppressed. This one now comes in, like like a double dose. So it may not be that it's the HSV that may be fatal in that your case, because you already have an underlying comorbidity. Or you understand what I'm saying? So if the person now dies from, for instance, a sore, a genital, herpes with a sore that was not properly treated, maybe there was now secondary bacterial infection on that sore, for instance, and then you now get a full-blown sepsis and then you die. So I'm not going to say herpes can kill, because in that instance that I've just demonstrated to you, there were other associated factors that now enabled that sore that the genital herpes caused to now kill that patient. I hope you understand exactly. So we're very careful, because they're scientific, they're medical. So you don't just say, herpes can kill. That's not how you say it. No.
So lastly, before we go, what's the general overview and advice for someone that just been diagnosed with herpes?
Go and see your doctor. Let's be sure we're dealing with his herpes. Let's be sure there are no other, associated factors. Let's be sure you don't also have HIV, because the way you contacted herpes, for instance, through unprotected sex, you could also have gotten a syphilis infection. You could have gotten gonorrhea infection. You could have gotten HIV. You could have gotten hepatitis B. You could have gotten hepatitis C. I can go on and on. So please just, for prevention, protected and safe sex. And then if you suspect anything, please go to the hospital or an STI clinic and go and see a doctor and let them just review you, and then they will manage you properly.
Thank you so much, Doctor, for coming on the show. Like, this is a very insightful conversation, and like I've learned so much from it.
And I hope the viewers have also learned. So thank you very much. It's a pleasure again to be here.
Thank you for watching up to this moment, and if you've not subscribed to our channel, please subscribe and support what we're doing here. See you on the next episode. Bye.